Hello and welcome to Karachi Ophthalmic Conference. My name is Dr. M. Mazhar Arwan. I am Chief Medical Officer, KhairunisaEyeHospital, a community service eye healthcare project of K&N's Foundation. The topic of my talk today is human resource development, bridging the gaps. I will be sharing with you the international, national and provincial data of primary eye care and the importance of optometrists in helping us reach out to those suffering from eyesight weaknesses and treatable visual impairment and blindness. Out of the 221 million people of Pakistan, 26.50 million people have some degree of eye health and vision issues. More than 80% of these 26.50 million people have causes that can be cured and their vision restored. In any discipline of healthcare and in any setting, primary care is of fundamental importance. In our context, it is an optometrist who assumes a WHO-recommended building block of development. Developed nations achieve this objective through organized development and deployment of this force at all levels of eye healthcare delivery. Assessment of the needs of this resource is of paramount importance in the planning of any community eye healthcare uplift program. Optometrists not only need to be mass-produced, but must also have adequate competence level. Any pragmatic plan begins, first of all, by establishing where you are, the situation analysis. Population of Pakistan is 221 million, with 1,000 optometrists, at the rate of 5 per million. Aim high, or what's heaven for? We chose United Kingdom as our benchmark, to compare and gauge ourselves. There are more than 200 optometrists per million, as against 5 per million in Pakistan. The national deficit. In this backdrop, it's easier now, not only to understand where we are, but also to get an idea about our gap estimates, and then be able to set our SMART objectives. In summary, we need optometrists workforce, 45 times larger than the current estimate. The provincial deficit. To look at the data, from the provincial perspective. We in Sindh, constituting 22% of total population of Pakistan, need to have a workforce of 10,000 optometrists. With this much dished out to policymakers, domestic and international NGOs and corporates, let us look at a very small bite to this serving. Our one-year internship program. The program was initiated at KhairunisaEyeHospital in January 2021. With extremely limited amount of resources at hand, rich curriculum content was kindly provided by the Brian Holden School of Optometry, Australia, courtesy of their country office. We tailored the content to suit our individual and community needs. The minimum admission requirement was fresh graduates having completed a 4-year program. We took in 4 optometry graduates as interns. They were assessed both subjectively as well as objectively against an extensive list of required clinical skills, to determine their training needs. This helped us to tailor-make their training program on individual level. We had them undergo a customized, skill-intensive, year-long exercise under the able guidance of optometry faculty and consultant ophthalmologists. The hands-on engagement was undertaken in a transitional and structured manner, from observational learning to supervised training and finally, more and more independent work. Though a drop in the ocean, but a forerunner of more significant efforts in future, an idea worth consideration by the ophthalmic fraternity nationwide, as well as the policymakers. Unique features of our optometry internship program: need-based curriculum design and modification, continuous assessment and improvement, inclusive eye health orientation to the students, deployment of LMS, learning management system, focus to enhance skills of optometrists, pre and post, subjective and objective internship appraisal, activity logbook, grading of skills on a scale of 1 to 5. Curriculum highlights: personal grooming, communication skills, time management skills and punctuality, ISO 9001-2015 quality management system, environment of care and infection control, IT skills, keyboard familiarity, word processing, spreadsheet, presentation skills, EMR and networking and learning management system. conflict management skills, child safeguarding and workplace sexual harassment policy and procedures, research, biostatistics, epidemiology, community ophthalmology, overview, inclusive eye health orientation. Exposure visits, collaboration with DPOs, habilitation and rehabilitation services, strengthening referral support network, community inclusive development, school screening programs. Preliminary end-of-the-year progress reports of a student to demonstrate the much-wanted outcome we proudly share. The skills are shown on the vertical side of the chart, and the progress bars in blue are depicted horizontally on a scale of 1 to 5. The left chart demonstrates the skill levels at the beginning of the internship program and the right one is towards the end of the term. It is the collective responsibility of society and all its stakeholders to institute greater and larger centers to educate and train our youth, on a fast-track basis in ever larger numbers to meet the demands and unmet needs of the visually impaired, spread awareness on a mass media level about the issues and provide advocacy. We urge the stakeholders to recognize, register, license, regulate, empower, entrust, encourage, enable, and financially sponsor to help them set up their own primary eye care centers in suburban and rural areas of the country, and provide quality primary eye care to the community at the grassroots level. We are a signatory of the United Nations Convention on the Rights of People with Disabilities. It is, therefore, a right of people and we must not shy away from it. Thank you for being patient listeners.